Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Chemotherapy drugs that cause hair loss. When people hear the word chemotherapy, they often think of hair loss as being one of its main side effects. An estimated 65% of people undergoing classic chemotherapy experience what doctors call alopecia. Not all chemotherapy drugs cause hair loss, though, and the severity of the hair loss or thinning can depend on a variety of factors. /r/n/r/n read on to find out more about why chemo drugs can cause hair loss, which drugs are more likely to cause hair loss, and when hair loss occurs. Your healthcare provider can also provide you with more information specific to your treatment regimen and situation. /r/n/r/n While chemotherapy drugs can be effective in killing cancer cells, they also damage normal cells that divide rapidly. This includes hair follicles, causing hair loss, cells in the digestive tract, causing nausea and vomiting, and cells in bone marrow, resulting in fewer red blood cells, white blood cells, and platelets, causing anemia and fatigue. /r/n/r/n Keratinocytes are cells in the hair follicles that help produce hairs. These keratinocytes divide faster than many malignant cancer cells, and they have a good blood supply that delivers chemotherapy agents to them efficiently. Their fast metabolism also puts them under oxidative stress. Chemotherapy drugs can enhance that stress to the point that the cell dies. /r/n/r/n In addition to hair loss from the scalp, chemotherapy can cause hair loss from other parts of the body, including the eyebrows and lashes, arms and legs, underarms, and pubic area. /r/n/r/n Whether or not you develop hair loss, and the severity of hair loss, depends on a number of factors, including /r/n/r/n chemotherapy medications with the highest risk of causing hair loss, or at least significant hair thinning, in many people include /r/n/r/n Some chemotherapy drugs result in only minimal hair loss, though these are often combined with drugs that cause more hair loss. These include /r/n/r/n Hair loss often begins around the time of your second chemotherapy infusion, though this varies widely. It may start slowly, but increases rapidly around 1 month to 2 months after starting treatment. Some people do not lose all of their hair until they have nearly completed chemotherapy. /r/n/r/n Hair regrowth typically begins within 3 months of concluding chemotherapy. When your hair does grow back, many people find they have what's been coined chemo curls. If your hair was straight prior to chemotherapy, it will likely become straight again, but this process can take up to several years. /r/n/r/n Chemotherapy-induced hair loss is almost always temporary and reversible, though there have been a few rare exceptions. /r/n/r/n Some women with breast cancer have developed permanent hair loss following a combination of taxanes, such as Taxol or Taxotere, and hormonal therapy, though this is rare. These are not the only treatments implicated. /r/n/r/n There have also been a few reported cases of permanent and severe hair loss in women with breast cancer who have received a combination of fluorouracilepirubicincyclophosphamide, with docetaxel. /r/n/r/n The newer targeted therapies for cancer don't usually cause total hair loss like chemotherapy drugs but can result in changes such as thinning of the hair and dryness, as well as changes in texture similar to chemo curls. Some targeted therapies may also affect the pigmentation of hair, often causing the hair to become darker. /r/n/r/n Some of the targeted therapies that have been linked with hair changes or hair loss include /r/n/r/n Some of the hormonal therapies commonly used for breast cancer have been associated with thinning of the hair for some people. Unlike chemotherapy, people may use hormonal therapies for many months or even years before they notice the changes in their hair. Hormonal therapies more often linked to hair loss include /r/n/r/n immunotherapy drugs for cancer, at least checkpoint inhibitors, do not usually cause hair loss, though oftentimes these drugs are used along with chemotherapy. Researchers are looking at ways of harnessing the gene involved in autoimmune alopecia, hair loss such as with alopecia areata, to improve the effectiveness of chemotherapy. /r/n/r/n There are a number of non-cancer related medications that are also associated with hair loss. These might accentuate the effects of chemotherapy drugs if used alongside them. /r/n/r/n Some of these include /r/n/r/n Other factors that can lead to hair loss include illness, surgery, or dietary changes, low-protein diets or very low-calorie diets. /r/n/r/n Thyroid disease, either hypothyroidism or hyperthyroidism, may cause hair loss and may occur as a result of cancer treatment, such as chemotherapy-induced hypothyroidism or hypothyroidism, which are very common with immunotherapy. /r/n/r/n There is no reliable way to completely prevent chemotherapy-related hair loss, but there are some therapies that may help reduce hair loss or help it regrow. They include /r/n/r/n Aside from these hair loss prevention strategies, it's also important to /r/n/r/n Hair loss is a fairly common side effect of various chemotherapy drugs. The severity of hair loss depends on things like the specific drug used, whether drugs are used in combination, the dosage, and how it is given. Other types of cancer therapies can also have effects on hair. /r/n/r/n While you may not be able to fully prevent hair loss or thinning, there are things you can do to reduce the risk and plan ahead for potential hair loss. Talk with your treatment team about the drugs you will be on and the risk of hair loss, and develop a plan to cope with it, should it happen. /r/n/r/ No, not all chemotherapy causes hair loss. Some chemotherapy drugs are known to often cause hair loss and hair thinning, while others may cause only a small amount of it. The likelihood of hair loss depends on the specific drug used, the combination of drugs, and the dosage. /r/n/r/n Chemotherapy can cause permanent hair loss and hair thinning, but in most cases, the hair loss is temporary. Be sure to ask your healthcare provider about the risk of hair loss from the drug you will receive. /r/n/r/n There is no guaranteed way to prevent your hair from falling out during chemotherapy. That being said, scalp cooling has shown to be effective in preventing hair loss in 50% to 80% of people using it. This treatment involves wearing a cooling cap before, during, and after chemotherapy infusions. It reduces blood flow to your hair follicles and the amount of chemotherapy that reaches them. /r/n/r/n Yes, it is possible for isotretinoin to cause hair loss. This is a side effect of the drug. Unwanted hair growth is another side effect, so the drug can affect everyone differently. Simultaneously using isotretinoin and a chemotherapy drug could cause hair loss to be amplified. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.